This is Dr. Yoli, increasing longevity and aging gracefully. As we get older, many changes occur in our bodies that increase our risk of death or disease. Men and women are experiencing a decrease in hormones that produces changes in their oral cavities, drying the mouth and increasing silent gum and teeth infections, bad breath in cavities. One of the worst changes is called periodontal disease. We see menopausal and perimenopausal women and andropausal men who never before had bone loss now experiencing both tooth mobility, gum recession, root exposure, bleeding gums, dry mouth, bad breath, and increased number of cavities and teeth. Sensitive to cold and hot, sweet, or air. Periodontal disease is an overlooked epidemic with grave consequences. It ranks as one of the top 6 infection diseases. Unfortunately, as it is contagious, kids can get it from their parents, grandparents, nannies, teachers, etc. My youngest patients were 8 and 10 years old. Although I do not see children, I was compelled to ask a couple who had moderate to advanced gum infection to bring their children to check and be treated. This saved the lives of the parents and prevented the children from developing heart disease. Statistics say that in the United States alone, over 50% of the population suffers from gum infection. In my experience, 99% of our patients have it and were never told or treated for it. Despite its prevalence, a mere 3% get diagnosed and treated. How is it that with half of our patients harboring periodontal diseases, so few receive treatments? This oversight is alarming, given that the disease stands as a leading cause of tooth loss in the United States. Although it originates as a local infection in the oral cavity, its repercussions resonate systemically. Ignoring it jeopardizes your overall health. In the 80s, it was called the silent killer in 2020 and 60 Minutes documentaries for those of us that knows what I'm talking about. By keeping your gums healthy, without gum disease, you can extend your life by 15 years. If you bleed when brushing, flossing, or have bad breath, you have chronic oral gum infection spreading into your heart, lungs, sinuses, brain, and predisposing you to other systemic consequences. For instance, periodontal infections make it challenging to control diabetes and vice versa. Oral infections are also linked to cardiovascular disease, stroke, dementia, various cancers, hypertension, premature births, and several other ailments. Timely treatment not only fosters oral health, but also mitigates the risk of these associated diseases. Indeed, numerous studies indicate that addressing periodontal disease reduces hospitalizations for those with comorbidities such as diabetes, coronary artery disease, and several vascular diseases. Insurance companies' research further underscores the financial benefits, revealing that marked reductions in hospitalization costs when gum disease is treated. So you literally are backed by the insurance because they don't want the bill to be an open heart surgery. They figured if we cover the gum infection, this patient is not going to need further work. So with such compelling evidence, why does periodontal disease diagnosis and treatment lag? It may boil down to mere lack of knowledge, oversight, responsibility, or habit. Having your teeth and gums checked and cleaned at least every 3 months is ideal. You gotta be responsible with your own health. Undertaking comprehensive examinations to diagnose and treat the disease will undoubtedly promote longer tooth preservation and enhance systemic health. Habits are powerful determinants of human behavior. Much like daily rituals of brushing your teeth, getting dressed, or taking morning showers, introducing and adhering to healthy oral habits relies on established structures and protocols that you must follow. Isn't it time that we all shift gears? By instituting standard protocols, we pave the way for improved patient general health outcomes. Embracing this change is a win-win. benefiting patients, their families, practitioners, and the broader community because gum infections are contagious. So if people have it, they speak over you, you get it. The path to better health can very well start with acknowledging and combating the not-so-silent epidemic of periodontal disease. Dr. Gupta, the CNN medical correspondent, he's a neurosurgeon, he wrote in his bestseller book that the easiest way to prevent dementia is by flossing. It's part of the protocol to reduce inflammation. Gum infection, inflammation goes into your brain, and that inflammation causes a cascade of reactions that actually could be prevented and improve your chances of not getting periodontal disease or the Alzheimer's or dementia, which is growing rapidly as well. Call us and check this off for your to-do list. We offer painless periodontal laser advanced technologies. Your health is your wealth. You will be thankful you did. For more information on how your oral health is connected to your overall health, call us or visit our websites, gonaturaldentistry.com or www.dryole.com. DRYOLIE.com. Thank you. This was Dr. Yoli, and I love you.